in spite of this recommendation, Health Canada, the department that is formally in charge of the final decision on who to give vaccines to, has decided to ignore the advice of the experts on the immunization task force.
Just days after Health Canada approved the AstraZeneca vaccine for use in Canada, the National Advisory Committee on Immunization says it shouldn't be going to those over 65. The concern isn't about vaccine safety. NACI says there's just not enough data to conclude how effective AstraZeneca is in seniors.
I'm concerned that this conflicting advice may lead to vaccine hesitancy among Canadian seniors. I'm concerned that these reports will lead to seniors delaying getting a COVID vaccine if a vaccine they perceive to be more effective than the one offered to them is not available.
Conservative health critic Michelle Rempel-Garner wants an emergency meeting of the Commons Health Committee to clear up this issue. At the time of approval, Health Canada regulators said it wasn't that there was no clinical trial data on seniors and AstraZeneca, just that there wasn't enough to make a recommendation. Dr. Teresa Tam doesn't sit on the immunization committee, but says she expects NACI's recommendations to change as real-world data on it comes in.
Just watch this space, as they see more and more of that real-world data accumulating. That will be adjusted as well.
Canada's first shipment of AstraZeneca, 500,000 doses, arrives Wednesday. Federal health officials also note that whatever is recommended, final say on who gets what vaccine is up to the provinces. But at least one has already made up its mind. Alberta says its seniors won't be getting AstraZeneca doses, but other groups could at a later date.
Now, how that's going to change the administration of those who are in phase 2 is still to be determined. We will be making those decisions and announcing them fairly soon.
Now, Canada's not the only nation in this boat. Both Germany and France have advised against giving the AstraZeneca jab to those over 65. But France just this week reversed track after learning that hundreds of thousands of doses were sitting unused. In Ottawa, Xiao Li, City News.